Okay, so in this video we're going to be talking about splitting, which is another abnormality in the heart sound. So we briefly touched on splitting in the previous video, but I'm going to go into it in a bit more detail. So remember we said that splitting usually applies to the second heart sound. And we said that the second heart sound is thought to be caused by the closure of the pulmonary, which is this one over here, and the aortic valve, which you can't really see over here. So the pulmonary and the aortic valve. And we also said that the pulmonary valve tends to close just after the aortic valve. And the reason for that, it's thought that because the pressure in the right ventricle is slightly smaller than in the left ventricle, when blood is pushed out of the pulmonary right ventricle, it's going to take a little bit longer to get out because of the decreased pressure, which means that the valve, the pulmonary valve, is going to close a bit later than the aortic valve. So you get this splitting of the second heart sound, which is physiological. It's a physiological split. However, you can get pathological splitting. And if you understand the mechanism of why this occurs, you can actually understand the different causes quite nicely. So let's talk firstly about what can increase the split. So we already said that the aortic component is just before the pulmonary, or the pulmonary is just after the aortic component, but what can increase that splitting? Well, the first is a right bundle branch block, and this makes sense because what is going to happen in the right bundle branch block? You have a decreased conduction to the right ventricle, which means the right ventricle is going to contract a bit later, which means that the pulmonary valve is going to contract even later. Okay, it's going to contract even later. So instead of being over here, it's going to be over here now because of the right bundle branch block. So there'll be an increased split. Same thing with pulmonary stenosis, because with pulmonary stenosis, what's happening? There's the flow across the pulmonary artery is going to be much longer. And because the flow is going to be longer, it's going to take longer for that pulmonary valve to close. Okay? So it all makes sense. What about VSD? Well, VSD, the blood is now shunting from the left to the right ventricle. Okay, and what that means is that there's now more blood going through the right ventricle to the pulmonary artery. There's more blood going through, the later the pulmonary valve is going to close, which is why VSD is one of the causes of a increased splitting of that second pulmonary sound. And then mitral regurg can also cause a increased normal splitting. And this is because if we think of the mechanism of mitral regurg, the idea is that the mitral valve is supposed to close during diastole at the start of systole, and then when the left ventricle contracts, it goes into the aorta. But if the mitral valve is incompetent, some of the blood is going to go in here, okay? It's going to go into the left atrium, which means less blood is actually going to go into the aorta. And because less blood is going to the aorta, the aortic valve is now going to close earlier, which means the aortic valve is now going to be over here. It's going to close earlier, which means that split is going to be even wider. So now we can understand that. Okay, so these are all different causes of an increased normal splitting. Then we get something called a fixed split. The difference between a increased normal splitting and a fixed split is that the normal splitting actually changes on with respiration. So when you inspire, we know that venous return increases. You have increased venous return. And when you have increased venous return, you're going to have more flow across that pulmonary artery. And because you have more flow across the pulmonary artery, the longer it's going to take for that pulmonary valve to close, which is why with inspiration, you'll get a splitting. So that's why when you're with a patient, if you want to try and pick up that split, you can ask them to breathe in, because you're going to increase the flow in the right ventricle, and then you're going to take longer. It's going to take longer for that pulmonary valve to close. But what's going to happen with an ASD, an atrial septal defect? Well, with the atrial septal defect, you are going to have a common connection between the two atria, which means that even with respiration, because there's a common connection between the two atria, respiration is not going to change the splitting, because even if you increase venous return, that blood is just going to go to the left atrium and displace itself. It's not going to increase the flow of the right ventricle, because there's a connection between the. It's like it's one atria now, okay? So that's why you get this fixed splitting with ASD. You do tend to get the split, but it's not a split that's going to change with respiration, which is what separates this from this. The fixed splitting doesn't change with respiration, this one does. And then the last type of splitting is reverse splitting. So remember we said that the normal splitting, the aortic component is just before the pulmonary. So what's reverse splitting? Yeah, when the pulmonary is just before the aortic. And what can cause that? Well, the same, left bundle branch block. Because if you have a left bundle branch block, that means that the conduction to the left ventricle is impaired, which means that the aortic valve is going to close much later now. So usually it's just before the pulmonary, but if you've got a left bundle branch block, the aorta is now going to close after the pulmonary, so you have a reverse split. Okay. And then if you have severe aortic stenosis, because what's that going to do? If you have severe aortic stenosis, then the aortic valve is going to take much longer to close, because there's more blood. Well, not more blood, but it's going to take longer for that blood to exit the left ventricle with aortic stenosis. And that's why you get the reverse splitting. Okay, so I hope this makes sense and that you have a better understanding of splitting. It's not really crucial for second year level, but I think it's good to be able to understand why the splitting occurs. I hope this makes sense.